Hello and welcome to today's edition of the Boston BioLife Innovation Series. Today we have the pleasure of speaking with Professor Mike Chan of the European Wellness Biomedical Group. Dr. Chan is a researcher, author, educator, and entrepreneur in the specialized fields of biotechnology, stem cells, peptide therapeutics, and regenerative medicine. So, Dr. Chan, thank you so much for being with us. We look forward to learning about your research and your interest in participating in the 2023 Heal Inc. Future Health Summit.
I'm looking forward to attend and to speak and listen to what the rest of the other people are talking about, because I believe in sharing and learning all the time.
So tell us about your research and how you think it kind of helps the overall field of regenerative medicine.
All right, and I'm 62 years old. I still have all the black hair with me. It's all real. And I've been in the field of regenerative medicine, which includes stem cell research, since 1985. That means I've been in the field for many years, 38 years, and today is my 39 years. And I went through a lot, trained by the Soviets in the old days, in the 80s, and trained by the Germans and the Swedes, and traveled to across 80 countries in my field of providing educations all along. So I sincerely think there's a lot I have learned about. When we are talking about in the 80s, you are doing research in stem cells. You know, we started with human fetuses in the old days in with the Soviets, and then again with the Swedes and the Germans in the old days in Europe. They will be dealing with the sheep. And after many years of experience with all this, I come to realize there's a lot of things we have learned up, and it's high time to share the information in Europe to USA. There's a lot of things I come to understand that in USA, there's certain things which can be unknown in the field, that the European therapies are unknown in a lot of ways in USA.
So what are some of the goals of the European Wellness Biomedical Group?
Now, we are called a European Wellness Biomedical Group is because we started everything as a research. I have done 43 books as an author and co-author of 43 medical and scientific books published in UK. In the old days, we contribute to one of the first stem cell book in the world. And why the word European is because when we started in Switzerland, we do have the centers, it's called Swiss Wellness Centers. But when we start to acquire hospitals and clinics across the world, including Germany or in Athens, in Greece or Santorini, and today we have around 43 centers too, apart from 43 books. We have also done 80 over publications. Our background as researchers and educators. But it so turned out that over the years, in education, we also, starting from 2009, we start to acquire hospitals and clinics. So the clinical experience also come in here now.
So is there any particular clinical area that you specialize in, or is it pretty much the entire spectrum of?
I would say the entire spectrum of biological and regenerative medicine. I will use the word integrative in this sense because all the physicians are medical doctors. It's just that the doctors in Europe, they also have their kind of European biological medicine, which we call them the common sense medicine. So where we will always treat the root of the symptoms and not just to treat the symptoms. Example, if someone say he can't sleep, we are not going to say you need the sleeping pills every day, because if you have to take the sleeping pill every day, it's only for one day. So if we can find out what is the cause for the insomnia problem in the patient, that is another way to treat the patient. So in this case, if you were to realize it, the melatonin is released during the biological hour of around 8 to 10 at night. So again, if the patients or the client is under some interruption where there is no release of melatonin, then he can't sleep. So one of our ways will be to give the pineal gland to stimulate the release of the melatonin. Again, in the treatment of diabetes, in our case, we will always give the islet cells. There are 13 cells and stem cells in the pancreas. But if you give the precise cells to treat diabetes type 1 and type 2, then the result will be much better. So we are talking about precision in medicine here. You give the right type of cells, then you have the better results. And in the human body, you have 78 different types of organs. You have 700 over different types of cells and stem cells, because every organ, example for the liver itself, as a filter is also a dustbin. So all the cells will surface in the liver. So in the liver, you will find you have 75 different types of cells. But the right way to regenerate the liver is to use the hepatocyte. So you need the hepatocyte to treat the patient, that you have a better result for the liver regeneration. Again, when you treat a heart patient, I would say it's good to use the heart stem cells or the peptides and not just to give any types of cells just to treat the patient. So when I say you have 700 or different types of cells, it matters a lot because here we are talking about A for A, a B for B, a C for C, a D for D, and not just an A for everything. So the misconception in stem cells also varies here because everyone is talking, they are thinking that, oh, stem cell can treat everything, but it's not true. I sincerely think in my clinical experience of running 43 hospitals and clinics across the world, and with my research, I would say that you need the right type of stem cells or cells or peptides or exosome to treat the right patient's condition. Everyone's has a different health conditions.
Yeah, that's interesting. So the cell derivatives that you're working with, are they through like pluripotent sources or induced pluripotent, or is it a form of tissue engineering?
Heidelberg has started long time with iPSC-induced pluripotent stem cells too. It's not just the Japanese. The Europeans have been doing it for quite some time. But again, we have to understand the principle here. There are 4 different types of stem cells. We can call them totipotent, or pluripotent. But in the case of totipotent and pluripotents, the word is pluripotent. That means they can turn into all types of cells. Okay, if you move down from the pluripotent, you'll be the multipotent. These are tissue cells. The word multi means they turn into 8 different types, and these are tissue cells. They're not organ cells. But the world seems to forget there's another type of cells which are called the precursor or progenitor cells. These are unipotent cells most of the time. When we use the word unipotent means these are organ cells. These are undifferentiated cells in their final stage of differentiation. That means a hepatocyte will always be a hepatocyte. It will not turn into any other cells. Compared to a mesenchymal cells, it may be a chance to turn into a cartilage, but not in the case of organ cells. So the understanding of precursor and progenitor cells need to be created more for the awareness, for more physicians to understand. So if I were to treat a Parkinson patient, I'm not just going to give the tissue cells or mesenchymal cells to do the stimulation of the brain. Here we are talking about the brain with 67 different types of brain cells and stem cells, 52 lobes of the brain. And when you treat Parkinson patient, the right type of brain cells to be given will be the substantia nigra. So I would rather give the mesenchymal cells to do the stimulation and the substantia nigra at the same time so that it will have a better result for the patient. Again, the patient could be a diabetic patient at the same time, and he could be 80 years old, so he also needs revitalization of his organ. We are as old biologically as our organ. The right way to do a reversal of aging and extend life will be to extend the quality life of our organs. Our organs all have a lifespan. The eye of all of us will start to age at 40. The heart will start to age at 40 to 50, and by the age of 70, your heart is only half the function of a 30-year-old. We start to lose our muscles at 30. We start to lose our hair at 30. So there's a lot of things which are around 30, 40, 50, and 60. The strongest organ is always the liver. You cut away 90%, it will still regenerate. But it's not the rest of the many other organs. Again, for the kidney, everyone will say, for conventional doctor will say, oh, the kidney is not regenerative, just like the heart. But if we can repair the dying tissue of a kidney patient, then we can regenerate the kidney. So it is our experience of treating CKD 4 and 5 and move them to CKD 3 and 2. So if you can repair the dying tissues of the organs and regenerate the dying tissues to be alive, that means you can regenerate the cells and the stem cells of every organ. So what I'm trying to tell the world is that it's not just a mesenchymal cells or tissue cells for the world in the treatment of diseases. You can use the mesenchymal cells, but at the same time, you can use the precursor and progenitor cells, and then you can use a combination of both. You can even use human allografts and autografts plus the xenografts together. That is our experience in Asia all along. And it has been ongoing in Asia for the last 40 years too.
Well, I think that I was going to ask you what your goals were for the Healing Future Health Summit. I think you kind of summarized them and basically bringing the community together to exchange the idea and facilitate research. But I'm impressed with your multifactorial approach and your pragmatic view of the science of regenerative medicine and tissue engineering. I think by combining the other factions that you've mentioned and looking at things as an ecosystem as opposed to an individual component, we stand a much better chance of curing these intractable inflammatory-based diseases. Type 3 diabetes is Alzheimer's is the view that's being coined now. So congratulations on all the wonderful work you're doing, and life-changing innovations in medicine is why I got into this business. It's the goal of the company, and it's the goal of all the groups we work with. So just wanted to say thank you so much for sharing your information. We look forward to seeing you in the Bahamas and learning more about the European Wellness Group and all the wonderful things you're doing to help people.
Yes, thank you, Joseph. And anyway, European-wellness.com, you can find a lot of publication and journals there. And